Support for Disrupted comes from the Connecticut Office of Film, Television, and Digital Media.
This is Disrupted. I'm Kalila Brown-Dean. Many people have heard the phrase private equity or private equity firm, but you may only have a vague idea of what those terms mean and what they do. And if so, you're not the only one. Today, we spend the hour with freelance journalist Megan Greenwell. She's author of Bad Company, Private Equity, and the Death of the American Dream. Megan's book tells the story of 4 everyday people whose lives were upended by private equity. And Megan also was affected when a private equity company dismantled the successful website where she served as editor-in-chief. We'll get into her story later. But first, I asked Megan to explain what private equity means.
This is really the reader I wrote this book for. Someone who has some sense that private equity is very important and that it's maybe having some negative effects in our society, but has no idea what that means, because that's who I was before I started the reporting of this book. Private equity does many things, but when I talk about private equity and when most people talk about private equity, what they're talking about is leveraged buyouts. And what a leveraged buyout is a private equity firm will pool together money from all sorts of outside investors. So pension funds, university endowments, ultra-wealthy individuals, all the common sources of big, big money, and then pool that together with bank loans to acquire a company. The bank loans end up making up the vast majority of any leveraged buyout. And the trick with private equity is that those bank loans, the debt is assigned not to the private equity firm that has decided to take out the loans, but to the company that they are acquiring. So if I buy Connecticut Public Radio for $1 billion and $800 million of that is loans, I'm not responsible for paying any of those loans back. Only Connecticut Public Radio is. And so what you end up seeing is that the companies are weakened by being acquired because all of a sudden they have all this new debt, while the private equity firm is doing just fine because they don't have any responsibility for the loans they decided to take out.
That example is perfect because private equity sounds like such a nice term. It sounds really sophisticated and alluring, right? Private equity. Everyone wants to develop equity. And really what you're showing is that it puts into a really negative situation, not only the company that's being bought out, but the people who are affiliated with that company, whether they are the leaders of that company, the people who are the customers, the clients, the patients of that company, and then transferring that debt while these firms have all these loans and are then acquiring wealth and amassing wealth in a very different way. That makes perfect sense. And yet there is still this gap between the public's understanding of what happens, those business leaders' understanding of what's at stake, and this process that's really happening. Why do you think there's such a gap between the real definition of what's happening and the public understanding or misunderstanding of what happens?
I think that's very much by design. The term private equity refers to the sources of capital, but it also works as a really nice explanation of just how little private equity firms have to disclose. And so it is super common that ordinary people, even very high information kind of voters, know nothing about how deeply private equity has burrowed into their own lives. One thing I heard over and over and over from workers was that they had no idea that private equity owned their company until everything went wrong. To take one example from the book, there was a woman who spent years and years working for Toys R Us. She didn't know who owned Toys R Us. Her boss, her boss's boss, her boss's 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 boss, they all worked for Toys R Us. Toys R Us was the name on her paycheck. The idea that actually the decisions were being made not at Toys R Us headquarters, but somewhere entirely different, using a set of incentives that had nothing to do with what is good for Toys R Us, that really benefited the private equity firms that owned the company, but that obviously worked against the workers, the customers, etc. In some sense, our modern day private equity system is the logical conclusion of America's worship of free market capitalism. But on the other hand, I actually argue that it's a bit of a corruption of free market capitalism because that one of the fundamental tenets of the free market system is that it requires all parties to have equal information. And that's why they have equal power. Workers can have power over their companies because they can use the information they have to make their own economic decisions. And that is not what happens in private equity because nobody knows what's going on in the gleaming office towers where these decisions are being made. And so private equity has gone to great lengths to make sure they keep it that way, that they don't have to disclose anything, that they can preserve all of their secrecy tactics. And so I don't think that gap is coincidental, and I do think it's really crucial to how the system works.
There is this thriving conversation in the US right now about the dignity of work and all of the ways that workers get condemned for not loving their jobs or not being committed and loyal to a company. And when you talk to Liz for researching this book, who was the employee of Toys R Us, you're able to relate what it meant to her to have this job, to have this connection to a classic, iconic company and a brand, and to feel that she was a part of something that was contributing to the betterment. And then that disappointment to realize that in some ways it was a smokescreen for things that were happening. Talk to us a little bit about what that meant for Liz and what you learned in talking to her about her experience at the company.
Yeah, I'm so glad you asked this question because people in jobs like retail work are obviously so stigmatized in our society and thought of as replaceable cogs in a machine. And Liz has spent her entire adult life working in retail, and she takes it so seriously. She has such pride in her work in a way that, like, was genuinely inspiring to me. Like, this woman got a Toys R Us tattoo on her shoulder because she loved her job that much. Liz is a researcher. Liz had chosen to work at Toys R Us because she concluded it was the best place for her to work to support her family. So she needed to move from Alaska, where she's from. She's a native Alaskan, member of a tribe there, had never lived outside of Alaska, but she needed to move to the mainland because her husband dreamt of going to pharmacy school, and there was no pharmacy school in Alaska, so she had to come to the American mainland. She did all the research, concluded that Toys R Us was the best, not only in terms of pay, but in terms of predictable hours, in terms of the ability to transfer when her husband needed to go somewhere else for his internship. And she was supporting a family of five people on a retail floor worker salary. And, she was everybody's favorite worker. Like, repeat customers would come back specifically to see Liz. And for a while, she was working at Babies R Us, where a huge part of the job is telling new parents, here's what you actually need, here's what you can skip, here's how to install your car seat safely, like really important stuff. And this couple had had a difficult pregnancy journey, decided to adopt. She was there through every step of the process. And they rush into the store one day saying, Liz, we need your help. We just found out that we're getting like a newborn like tomorrow. And she was like, no problem. I've got you. She drops everything else, helps them pick out everything they need and nothing they don't. And they come back into the store like a week later with their baby, who they have named Liz. So to see someone like that who was so fundamental to making Toys R Us a successful company. Toys R Us was known for having good customer service because of people like Liz. And the moment the private equity firm decided this isn't really in our interest anymore, they kicked Liz and 33,000 other workers to the curb. No severance, even though their contracts guaranteed severance. it was just really disheartening to see people treated that way after they really poured their hearts and souls into this company.
There is a sense of empathy that you bring to this book, an understanding of, yes, these are for some people just financial decisions. And for others, for the masses who are affected, these are life consequences that don't just impact that worker or that executive. It really impacts families, communities, and in Liz's case, a generational understanding of what it means to bring your whole self to your place of employment and have it erased as if your dignity didn't matter, but as if your contributions did not matter. Megan, you also were affected by this private equity enterprise, we'll call it, and the ways that it makes those decisions. Share with our listeners how you were directly impacted by a private equity company.
Yeah, so I got interested in this because I also lost my dream job after a private equity acquisition. I was the editor-in-chief of a small sports publication called Deadspin, and that was the job I most wanted in the world. When I applied for that job, I was sort of like, I truly don't know what I do if I don't get this job because this is the job I want, and anything else would feel like settling. And I knew that the company was going to go through an acquisition process soon when I started the job. And Deadspin was doing great. Deadspin was profitable. Deadspin had a huge audience. So frankly, I wasn't that worried because who would come in and mess with a thing that is working? And just immediately, it was clear that this was not going to work out. On the very first day that the private equity firm owned our company, all of their like handpicked executives came in and started asking truly the dumbest questions about what we even did. And then one of them asked me, and I'll never forget this conversation. One of them asked me, "Why are you the right person for this job?" And I was just sort of like, honestly, the proof is in the pudding. Like, I'm very clearly the right person for this job because I'm creating a successful product. But they didn't want what we did. They didn't have the curiosity to even fully understand what we did. They just wanted scale at all costs. And what ended up happening was they blew everything up and got nothing. They drove me out of my job within about 3 months. 2 months later, the rest of the staff followed me out the door. For a while, the site just wasn't publishing at all because they had no staff. Then they hired some, you know, um, not to be undiplomatic, but they hired some sort of second tier people to replace us. We're never able to bring the audience back. And then they ended up selling to like a Maltese gambling company. So they drove the publication literally into the ground, but they cost a lot of people their dream jobs in the process. It was so frustrating to me that that was what really drove me to understand, okay, how does this play out in other industries? Industries that frankly are a lot more important than like my little sports magazine, right?
I'm listening to you share this story, and there is this look of, I don't know if it's surprise or indignation on my face as I'm listening to you share this. Because I also know that one of the other things that often happens in our society, unfortunately, is that people feel this sense of shame that is not theirs to carry, right? I worked so hard for this. I was doing all the things I was supposed to do, and it was taken away from me. And because of that shame, because of that stigma, people often don't speak out or they don't share their experiences because they believe it is uniquely their own experience, or they start questioning what they could have done
Yes.
differently, particularly for those who are in a position where there are others that they are responsible for or who are looking to them for leadership. And so I want to name that to thank you for sharing your experience, because I know that it helps others understand the complexities of this. But you also create an environment where others can say, I too was affected by this.
Mm.
Were there other people that you talked to as you were doing the research for this fantastic book that their experience stood out to you to say, we need to share these stories more broadly to really understand the impact of
Hmm.
this trend?
So there are four primary protagonists in my book, one representing retail, healthcare, housing, and local media. And I talked to probably between 150 and 200 people, kind of auditioning them for what became these four characters. And the thing that stood out about these four, the thing that made me realize that they had to be my four, was that they were so fired up to push through that shame and tell the full story. All of these people talked to me about some of the darkest days of their life, and they did so willingly. And I do not blame anyone who's not willing to do that. But the fact that there were four people who were willing to do that was an absolute game changer. So, Roger, who is the doctor character in my book, he grew up in Texas, and all he ever wanted to do was be a rural community doctor. And so he moved from a very well-funded hospital in a wealthy community outside of Dallas to rural Wyoming just so that he could practice rural medicine. And Roger is such a lovely person to talk to. He's in his mid 80s now, and he's very philosophical about what his career has meant to him, to his community, etc. And we had this conversation that rings in my head all of the time, where he said, "Look, when I moved here, my only goal was to leave this community better than I found it. And for a long time, I felt like I was doing that because I was taking care of patients, right? That was what I wanted to do. I was, in a very tangible way, making people's lives better." And then he starts weeping and he says, and then this private equity firm came in and they so fundamentally undermined everything that I had worked for that all of a sudden I found myself 80 years old and feeling like all of a sudden I wasn't going to leave this community better than I found it. I was going to die having seen this hospital absolutely stripped for parts. I won't fully spoil the way he combated that, but he and some neighbors came up with a really radical solution to make sure that that didn't end up being the culmination of his story in Riverton, Wyoming. Whether it's medicine, whether it's retail, whatever the industry is, the fact that there are people out there who are willing to sort of link arm in arm with their neighbors and say, we're just not going to stand for this, was so exciting for me to see. Like, it made the reporting really, really fun. And Roger did have a real sense of shame about this for a long time. And the way he got past that was by doing something to fight back, which I just think is like a cool type of person to have in the world.
You're listening to my conversation with Megan Greenwell. She's author of Bad Company, Private Equity, and the Death of the American Dream. When we return, if you think that private equity doesn't affect you directly, I want you to consider the influence these companies have in our political system.
88% of elected members of Congress and the Senate receive donations from private equity.
This is Disrupted. We'll be right back. Welcome back to Disrupted. I'm Kalila Brown-Dean. This hour, we're learning about the business of private equity with freelance journalist Megan Greenwell. Her book is Bad Company, Private Equity, and the Death of the American Dream. Before the break, we heard the stories of two people profiled in Megan's book. Both of them were devastated by private equity firms. One worked in retail at Toys R Us, and the other was a doctor practicing medicine in Wyoming. These two examples illustrate the vastness of the problem and the many variations in communities that are affected by private equity takeovers. But it's not just something happening in cities. It's happening in rural communities across the country where access to healthcare is already a challenge and where the need is tremendous. Private equity isn't new, but the impact has grown exponentially. Ask Megan what's driving the growth of these acquisitions and the impact that it's having on so many people.
And a lot of it is that from the private equity firm's perspective, it works, right? It works great because in the best case scenario, you take a house flipping approach and you make a massive profit off of it. And in the worst case scenario, sure, you might tank the company, but it doesn't matter because you, as the private equity firm, are still going to make your money. There was a famous private equity deal in the 1980s, an auto parts manufacturer in Buffalo, New York, that got bought by KKR, which is still one of the biggest private equity firms in the country. They drove the company into the ground. Like it went very, very poorly. It was one of the first deals where they financed almost all of it with loans. There was another executive of a rival finance firm who told the New York Times, he said, "Oh, we were all looking at this and going, holy mackerel, we can do this too." So it really is a sort of follow the leader kind of industry where you'll see one firm create a new tactic and then everybody else wants to get on board. And I think when you see the growth of various industries that are becoming more and more dominated by private equity, you see that follow the leader approach too. So there was a leveraged buyout in 2006 of HCA, one of the biggest hospital chains in the country. There wasn't a ton of private equity money in hospitals until 2006. But then everybody looked at this HCA deal and said, wait a second, same thing. We can do that too. Another big factor was part of what drove the VC boom is also what drove the private equity boom because there was just a lot of cheap money out there. If you could borrow money on 0% interest rates and then charge the debt to the company you were acquiring, like that was great for everybody. Everybody in the private equity firm, right? And so you see the same playbook start in some industries and expand to others. Retail, for example, we talked about Toys R Us. Retail used to be a huge area of investment for private equity. Now, private equity sort of feels like retail's dead, and so they're all out of it. But many of the same strategies they pioneered in retail, they are now applying to hospitals, housing, what have you. Part of what was interesting in reporting this book to me was being able to trace that chronology of, okay, here's where this particular tactic started, here's how it spread. And it's really easy to see the patterns once you sort of like sit down and lay it all out.
One of the other patterns that you lay out in this book is the sort of bipartisan support
Mhm.
of private equity, of these acquisitions, of the expansion, of being able to either circumvent regulations or prevent regulations from happening. And I think it's such an important point because the public perception is often Republicans are the party of business, they are the more business friendly party, and therefore, if something is happening, we need to point our finger to one party. You show in this book that no, actually, Democrats and Republicans have benefited from the lobbying, from the campaign donations, from some of the commitments, if you will, to making sure that this private equity as an industry can continue to thrive in a bipartisan way. Tell us more about that sort of political agreement of Democrats and Republicans as parties both being a part of this conversation.
The statistic that most horrified me in the entire book is that 88% of elected members of Congress and the Senate receive donations from private equity. That is across the aisle. In many cycles, more money goes to Democrats than to Republicans. I live in New York, and in many election cycles, Chuck Schumer has been the single biggest recipient of private equity donations. In some cycles, it's not been particularly close either. He will get, three or four or five times as much as other folks. So when Donald Trump was first reelected last November, I had a bunch of reporters call me and say, "Oh my gosh, isn't this going to make private equity so much worse?" And my answer was no, I don't think so, because the Democrats, for the most part, have shown no more appetite to regulate private equity than the Republicans have. In fact, just before the election, there was a bill passed by the legislature in California to increase scrutiny of private equity deals in healthcare. And private equity observers were really watching to see what Gavin Newsom would do about this because Gavin Newsom was such a strong surrogate for Kamala Harris. And so everybody was like, okay, yeah, what he does will be what Kamala Harris wants him to do. And he vetoed the bill. So I think one thing that can inspire a lot of hopelessness on the part of people who are progressive about regulating big finance is that, yeah, the private equity lobby is huge. Their power in Washington is absolutely massive. And they have, a pretty strong capture on Republicans and Democrats alike. And also, there's some interesting work happening. Elizabeth Warren has proposed what she calls the Stop Wall Street Looting Act time and time again. In the foreseeable future, that's not going to go anywhere because she just doesn't have enough colleagues who think the way that she does. But there is some work being done on the state level in various places to regulate this. So in Massachusetts, there was a bill similar to the one Newsom vetoed in California to increase scrutiny of private equity deals in healthcare. Now, this grew out of a major private equity hospital disaster from a Massachusetts-based company that also owned hospitals other places. So it is unfortunate that it took a catastrophe to get to the point of achieving this regulation. But you know what? Massachusetts passed it, and the governor signed it. So now it's one of the strongest pieces of legislation out there regulating private equity in healthcare. So I don't want people to be hopeless about the possibilities. I think people just need to think more expansively about, okay, private equity runs Capitol Hill. What are the other ways to sort of tackle this problem?
One of the things that we talk about quite a bit on this show is with so much uncertainty and seemingly dysfunction at the federal level, you're seeing real change happening at the local and state level of people raising issues, of people being able to organize or link arms, as you talked about in Wyoming, in order to raise an issue, raise public awareness, and then inspire action. And with all that you're talking about in terms of the number of people affected, the sort of stronghold that private equity has at the federal level, I'm sure there are some people who may be listening to this conversation and thinking, I don't work for a company that's owned by private equity, or I don't work in an industry where I think private equity would be interested. So why should I think about this? What do you say to people who feel like they're safe or they're insulated from this pervasiveness of private equity? What's your response to that?
My response is if private equity is not in your life now, A, you are very much the anomaly and not the norm. And B, I promise you they are coming for you too. So maybe they won't ever own your company. I work for myself, right? So I can promise that private equity is never going to own Megan Greenwell Incorporated, but I can also very clearly see all of the other places they're involved in my life. So private equity is huge in dentistry now and really raising the prices for basic dental care. Huge in like preschools and nursery schools. Huge in housing. There are places where they own like 35% of the single family houses. So the Private Equity Stakeholder Project, a great research group, just did this big study about where private equity owns the most apartment units. And in Raleigh, North Carolina, they own 35% of all apartment units in the city. And guess what that results in? Higher rents, fewer services, more maintenance problems, all of the things that you would expect. Private equity is also getting into management of public utilities now. So if you think there's no private equity in your life, look at who the management company is for whoever your electrical provider is, or who is like managing the toll roads in the place that you live. I think there are very few people who are correct that there is no private equity involved in their life. And I think if you are one of those people, you can rest assured that it is only a matter of time. This is truly everybody's problem. And if more people don't start thinking about it as their own problem, their dominance is just going to continue to grow.
I keep coming back to this point in your book, which is really no one is immune, regardless of your wealth, regardless of your economic status, where you live, how you live. We are all affected by this, whether it's in a directly proximate way or at a distance, in terms of the quality of the services we receive, the ability to know our medical providers or know our landlord and be able to communicate and have that reassurance that someone will be responsive to us. Megan, when you talk to private equity companies and raise these concerns, their response is, listen, we are helping out businesses that would have gone out of business otherwise, or we are helping to standardize some services. Maybe we're more cost efficient. Maybe you get the brand name recognition, if you will. It's what I hear in healthcare all the time. You get that brand name recognition. And so actually, we're providing a service because they would have gone out of business, but for our infusion and our takeover. Do you think that's really true, or is that an excuse to do the thing they want to do anyway?
Yeah, it's so interesting because private equity executives really do present themselves as these sort of swashbuckling heroes swooping in to save the day. They paint themselves as like specialists, like medical specialists, where they are the best positioned to come in and save the patient. What they are actually is specialists in finance. They are very, very good at making money. They are not good at saving companies. And the data is super clear about this. 10 times as many private equity owned companies declare bankruptcy as companies under other types of ownership. By the numbers, they are worse for companies than other kinds of ownership. Now, their defense to that is, like you say, yes, we take over companies that are at more risk anyway. But if you're painting yourself as the solution to those problems, and then the companies you take over are 10 times more likely to go bankrupt, are you actually very good at your job? They're very good at their job, but their job is not saving companies. Their job is making money for themselves and for their investors.
I appreciate that clarification of understanding what the job really
Yeah.
is and seeing that in a different light. Is there an example that you have of where a private company coming in, taking over, actually was a benefit, not just to the private equity firm, but to the company or to the people that are connected to it? Is there an example where you say, this is how it could be done right or be done in a way that is actually mutually beneficial?
hmm So the private equity, their main lobbying group likes to point to the fact that the majority of deals of leveraged buyouts are actually for small family-owned companies, not for big hospital chains, retail chains, whatever, like the ones I focus on in my book. I have no reason to doubt that that's true. I think that probably is true. And I think it's also likely true that those deals tend to be more successful. Private equity started in the 1960s with what they called bootstrap deals, which were essentially taking over small family-run operations that had the potential to expand, but didn't have the capital they needed to expand, and infusing a bunch of capital and allowing them to grow. That's, a pretty unobjectionable system for the most part. Yes, any private equity executive will point you to a number of very successful deals. So, one that the co-head of global private equity at KKR likes to point to is a garage door manufacturer based in Illinois, where they actually gave the workers ownership stakes in the company. When they took it over, they said everybody gets whatever percentage based on how long you've worked at the company. They made the company much more successful, sold it for a huge profit, and a bunch of like truck drivers and factory workers got a huge infusion of cash from this deal. So it's not that it can never work out. But one thing that I think about a lot is even though the private equity lobby points to the majority of deals happening at these smaller companies, that is by no means the majority of the money, right? You can do a trillion tiny deals for small amounts of money. And yes, those are the bulk of your total deals, but it is not the bulk of your influence. And so it tends to work out much more poorly at bigger companies. And the bigger companies are the ones that affect many more workers and have a much larger effect on their surrounding community at large. So it's not that private equity can never work, but it is that in the biggest, most influential cases, they tend to have the most deleterious effects.
That was Megan Greenwell talking about her book, Bad Company, Private Equity, and the Death of the American Dream. Coming up, despite the pervasiveness of private equity, you have power too.
It doesn't matter how regular a person you are, how little political power you have, there are things that you can do.
This is Disrupted. Stay with us. Welcome back to Disrupted. I'm Kalila Brown-Dean. My guest for the hour is Megan Greenwell. Her new book is Bad Company, Private Equity, and the Death of the American Dream. Megan breaks down the growing influence that private equity has over our lives and its impact on all of us in retail, in media, in politics, in housing, and healthcare. But Megan also says that private equity is showing up more and more in the public service sector, including education. The idea that preschools are now subject to private equity takeover, hospitals and healthcare. There's a lot in the book about public pension funds. And as someone who lives in the state of Connecticut, where there are lots of debates right now at the state level and at the local level about the commitment to public pension funds, what it means to claw back some of the provisions, and the ways that private equity has now inserted itself in those public service functions and still being able to benefit because of that lack of capital or the lack of the ability to expand that. You also talk in the book about the work of Milton Friedman, and I felt like I was taking my grad school political economy course all over again, right? To say, yes, it's free market capitalism, but it's not
Yeah.
supposed to work this way in these areas. Talk to us about how you think about that, these public service functions, and the ways that private equity has its hands in areas that someone like Milton Friedman would have said, wait a minute, it shouldn't be there.
Yeah, this was so interesting to me. So, unlike you, I did not go to graduate school, and embarrassingly, I never took an economics class in college. So, I had to sort of like give myself an economic history education during the reporting of this book, which was fun. I mean, it made me really wish I had taken economics classes. But obviously, CEOs of big finance firms just absolutely worship Milton Friedman. And obviously, progressives tend to think Milton Friedman has had a terrible legacy in terms of what our economy has turned into. So, when I first went back to Milton Friedman's famous 1973 essay about shareholder value theory, essentially saying that the only point of a company is to make money for its shareholders, what was so fascinating to me was that nobody ever talks about this one line in that essay, which says that there should be exceptions for businesses that have a public service function. And he specifically calls out schools and hospitals. And private equity these days is so big in education and in hospitals. As much as these guys consider Milton Friedman the figurehead of all things good and holy, it is difficult to justify the ways in which you are directly contradicting what Milton Friedman said. I'm glad you brought up the pension funds because that's another huge part of the private equity narrative. We're benefiting all of these retired teachers, firefighters, nurses, etc., by investing in private equity. And the private equity leaders will say, look, our public pension system is broken right now. And I did not realize until starting the reporting of this book just how broken. I talk a lot about the California Public Employees Retirement System, which is the biggest public pension fund in the country and is horrifically underfunded, right? There is just like no way to actually fulfill the obligations to all of these teachers, firefighters, nurses, etc. And so private equity is saying, look, these people rely on us. Do you want to be in charge of taking away a retirement from a firefighter who worked for your community for decades? Because that's what you're going to do if you regulate private equity. And what is so problematic to me about that line of thinking is it positions our economic system as a zero-sum game, where the only way to benefit this group of, mostly middle class workers and retirees is by screwing over this other group of middle and lower middle class workers, right? So the nurses in California can have a nice retirement, but only if we don't pay any severance to Liz, the Toys R Us worker. I just think that is such a dangerous way to think and is so contrary to a democratic system, right? I think a lot about how involved private equity is getting in our public services. I would like more people to fully understand what that means for our future because it's only going to continue to grow.
I want to say that I don't think you give yourself enough credit. So you said you never took a class in college. You just gave the year-long seminar in about 4 minutes to
Oh,
sum it up. And you have taken a subject that is so complex and so complicated and brought it to a granular level so that we can understand what's happening. And again, to your earlier point, how it is really affecting everyone, whether they realize it or not. As you were talking about this and the ways that private equity positions itself in the pension discussion, I scribbled the word zero sum on my page. And so then when you said it, because that's what we see. We are on the cusp of major elections in the United States. And I'm not even talking about at the national, federal level. There will be key elections within states of choosing governors or choosing mayors who will have a say over what happens with those public pensions. Local city councils and boards of alders will have these discussions about how they will continue to fund. And what always happens is these groups show up in those public debates and hearings and pit groups against one another.
hmm
And as you said, if you support this group, that means you don't support the other. And the nature of power is that approach to fear, whether rational or irrational. Fear becomes such a powerful driving force. As we are approaching those elections, what do you say to voters who will read your book and be very alarmed about the pervasiveness of private equity and the vulnerability that we have as everyday folks to be affected? What do you say to voters as they're thinking about their choices and what's at stake?
I think that the four stories, the four characters in this book show really clearly that there are things you can do. If you are really motivated to tackle this, it doesn't matter, how regular a person you are, how little political power you have. There are things that you can do. The four folks in this book, none of them had a particularly large amount of power within their whatever their location is, whatever their industry is. And yet, they were all so fired up about this that they found ways to fight back and they teamed up with a bunch of other people who were fired up enough to fight back. One story from the book that I think a lot about. So, the housing section is about a woman in Northern Virginia named Loren DePina, who Loren is one of the most impressive people I've ever met. She is a absolute firecracker, and she is never afraid to tell somebody when she believes they are absolutely wrong. And Loren, when she moved into this apartment complex in Northern Virginia, a huge percentage of the residents of that apartment complex are recent African immigrants because it just kind of became a place where, you know that there are people there, the rents are below market value. It feels like a good place. And so that's self-reinforcing and it becomes a hub for those people. Loren is not an African immigrant, but Loren's parents are African immigrants. Loren knew that even though she had not that much power in her society, she had a lot more power than a lot of these folks who were her neighbors, who didn't have great English skills, who were scraping and clawing just to survive, all of these things. And a huge part of what motivated Loren was I might not have that much power, but I am the most powerful person I can see. I have some moral obligation to do something for these folks who have a lot less than I do. When I was with her over, a several day period, her phone was just constantly blowing up with texts, WhatsApps from her neighbors saying, Loren, I don't know how to deal with this. Like, please help me. Sometimes the kids would write messages for their parents who didn't write great in English. She would just drop everything to answer those text messages. And I think that, like, bringing that ethos and while being realistic about what power ordinary people do not have, also thinking expansively about what power we do have is a really beneficial thing to do. I think I don't want to be too cheesy about it, but I do think hopelessness is really the enemy in so many ways because it inspires this lethargy where you feel like there's no point in even trying. And I hope that when readers read about the characters in my book, and I think it is impossible not to be completely captivated by these four characters because they're just amazing people, that will then show other ordinary people, okay, well, if they can do it, so can I. Like, to sort of take that Loren ethos of, well, nobody else is coming to save me, and nobody else is coming to save my neighbors, my coworkers, whoever it is. So I guess it's on me, and I can recruit other people too.
I think we all need the reminder of the power that we have individually, but the power we have collectively to stand together wherever we are, in whatever situation we are in, to make a difference and to speak out and speak up. And in these times, Megan, we especially need those reminders of the goodness that's around us and also within us. So we thank you for reminding us of that. Megan Greenwell is a freelance journalist and author of Bad Company, Private Equity, and the Death of the American Dream. Thank you so much.
Thank you so much for having me. It was such a good conversation.
Disrupted is produced by Kevin Chang Barnum, Robin Doyon-Aiken, and Meg Fitzgerald. Special thanks to our interns, Coco Cooley and Isaac Moss. You can listen to all the previous episodes of Disrupted by finding us wherever you get your podcasts. Just search for Disrupted and Connecticut Public. And if you love an episode, please rate it on your favorite podcast platform. It helps other curious listeners find our show. I'm Kalila Brown-Dean. Thanks for listening.